Did you know that in a recent school sports survey, dance was found to be the second most popular physical activity after football for young people in England? It's due to the success of programs like Strictly Come Dancing and Britain's Got Talent that dance is now more popular than ever. And with the increasing rate in obesity threatening the health and happiness of our children, there couldn't be a better time for young people to get dancing. While public health professionals try to combat obesity, dance can play an important role in getting young people up and moving. A number of organisations in England are working hard to harness the current popularity of dance to encourage young people to get active. Others have been busy researching the health benefits of dance for young people so that we have robust evidence to prove that dance can have a positive impact. Let's take a look at some of the most successful youth dance and health projects that have recently taken place in England. Dazzle is a community dance project for young people based in South Leeds. It was established in 2000 as a public health initiative funded by the South Leeds Primary Care Trust. We spoke to the founder of Dazzle about what's been achieved over recent years in South Leeds.
Dazzle stands for Dance Action Zone Leeds, and it is a dance and health project that aims at improving the health of children and young people through dance. And its main purpose is to deliver a wide range of dance sessions across Leeds, focused on disadvantaged communities, very much aimed at getting inactive children involved. And we run regular sessions, we run summer schools, and we run regular performance opportunities for young people. What Dazzle does brilliantly is it starts where young people are at. So we do a lot of street dance, cheerleading, which is very popular and very kind of like, ooh, so it's kind of like good uplifting and quite an aerobic kind of form of dance. And then we also have break dance. We do help run an older contemporary dance strand where we like to try and widen the horizons of children once they've got involved. But our starting point is very much about popular dance. One of our top priorities is working with inactive children. So the National Institute of Clinical Excellence, they have identified certain groups who are most at risk of inactivity. And then the other thing is looking at more holistically well-being, so building self-esteem, building confidence, and so forth. Since Dazzle began, we've trained 60, 70 youth dance leaders, and one of the original young dance leaders that we developed, Ian Rodley, who's just developed the first boys cheerleading squad in Europe, he's now actually just been appointed as the new director of Dazzle, which is fantastic, and I'm sure there'll be lots of interesting and new developments that will come from that.
Dazzle has been very successful in getting young people physically active through dance. But success of this kind is only possible if there is a highly skilled and well-trained workforce available to lead dance activities for young people. Dance Active is a training course that was piloted in the West Midlands in 2009.
Dance Active was a training course for dance artists and also for commissioning health professionals. But it's a lot more than that. It's also an awareness-raising initiative. We knew at Dance Exchange for a long time that health professionals were interested in working with dance. They saw it as a physical activity that people wanted to engage with. So we knew that they were interested, they just didn't know how to commission projects. And we also knew at Dance Exchange that dance artists were interested in working with the health sector, but didn't know how to make those inroads. So we started by having a conference where we got everybody together, and we had lots of workshops that could show how a dance project could work with teenage binge drinking, as well as look at tackling healthy weights, as well as tackling things like nutrition. And then after that, we started the course, and we trained both dance artists and also commissioning health professionals over a 3-month period. Having society in general healthier isn't Conservative or Labour or Lib Dem. The health inequalities isn't going to change, and it's something that everyone will need to address. Whatever happens, I think the next few years will definitely be a deliverer's market. What we've done is we've trained artists to deliver, and we've trained health professionals to deliver projects rather than deliver ideas or strategies about projects.
Until recently, there was very little research to prove that dance can have a positive impact on the health and well-being of young people. Fortunately, a number of recent research projects have provided us with robust evidence. The first of these was the Hampshire Dance Energy Project back in 2005.
We all know that dance is good for young people, and Hampshire Dance wanted to prove this. We set up the Energy Project, which aimed to assess the health benefits of creative dance on young people, whilst also giving them an enjoyable dance experience. "350 school children aged 11 to 14 took part in the project, and throughout the course of the 10-week programme, dance scientists from Trinity Laban assessed changes in the physiological health and psychological well-being of the participants.
Well, one of the aims for Trinity Laban's Dance Science is to look at ways of scientifically understanding the role that dance can have among young people in terms of their health and well-being.
The research found a significant increase to the physiological health of the girls who took part in the project. There were also positive changes to areas of psychological well-being in both the boys and the girls who took part.
And we found that dance could be considered as an alternative to sport in regard to its benefits.
The project was groundbreaking in that it was the first of its kind to provide robust scientific evidence for the health benefits of creative dance for young people. The findings were launched in 2007 and generated a great deal of interest from both the arts and health sectors, and we were really pleased that 2 government ministers attended the launch event. The Hampshire Dance was interested in exploring further the different health benefits we'd seen between boys and girls in the first Energy Project, and this became the starting point for a follow-up study which has recently taken place in West Sussex. This enabled us to explore these gender differences in much more depth.
We used to hate PE, but now it's actually quite fun to come in and do some dancing.
Totally agree. Because it's fun, active stuff. So you actually like it and you know it's actually good for you. We reckon it's a really good idea.
The Dance Science Department at Trinity Laban has been involved in a number of dance and health research projects since the first Energy Project.
Another project was entitled Dance for Your Life. So we went into schools in the areas around North Kent and we looked at the impact of dynamic contemporary dance on areas of health and well-being. And we found statistical significant results in areas of physical fitness and upper body strength. So I'm obviously personally pleased with these results because I've danced all my life and I know what dance can do. But to have the science behind it has been a really important step for us, for me and for the dance world, I think.
There are many ways of getting young people active through dance, but some of the most creative projects are those where the dance and health sectors work in partnership. There is an excellent example of this in the southwest of England.
We're working on a strategy called Be Active, Be Healthy, which is designed to increase levels of physical activity and reduce obesity. Projects have revolved around 4 mass participation dance events which have worked strategically with local partners including the Primary Care Trust, Local Authority, Healthy Schools Plus, the dance partners, schools and colleges. The events have really showcased dance as well as developing preliminary dance activity. They're also leaving a legacy which is about continued and sustained dance activity as well as profiling dance locally. The other projects have been funding to primary care trusts, which is more about local ongoing dance delivery to a range of different dance partners and different dance styles. And the post is funded by Youth Dance England, Arts Council South West and Dance South West. The reason it's so groundbreaking is because of the relationship that's developed between Dance South West and the Department of Health in bringing in a dance specialist to deliver national initiatives at a regional level. Through this post, I've really recognised that collaborative projects are really essential. We've been able to really demonstrate value for money, improve partnership working, meeting shared agendas, and the collaborations that have developed over the post lifespan have really been able to demonstrate a longevity, and hopefully those partnerships and collaborative relationships will go onwards into the future.
You can see from these brilliant examples that it's really important that we continue to fund youth dance and health work. If we work together, dance can play an important role in securing a healthier and happier future for young people in England.
I think it's extremely important that we continue this work. This is the tip of the iceberg. There's a lot more to be done. We've worked with a few schools in the different projects and we've got some amazing results. However, we need to do more research. We need to look at other areas of health and well-being. We could look at perhaps longitudinal studies that go beyond 1 or 2 academic terms to see what impact dance can have over a longer period of time.
I think it's vital that the work of this kind and research continues to receive funding. Despite the exciting findings that we have gained so far, we really are at the beginning of the road.
It would be a shame to stop now.
The big health issues that are around, which is obviously obesity and mental health, are two of the biggest ones. They aren't going away. If anything, they're getting worse. I do have a whole generation of adults who are physically unable to literally have any quality of life because they're so overweight or obese. I mean, that's really what we're up against. And I think dance has a unique ability to tackle that, because dance is actually a lot of fun and people can really enjoy themselves. They can have a great time doing it. And that's what we need. We need motivators that are going to capture those people who are really not going to go down the gym and necessarily want to just bash it out on a machine, and they just need something that's going to be more fun and more inspiring. So I think dance has got a big part to play.